moment Caleb stepped into the medical training hall, he knew something was off. A group of alien students, most of them from species that prided themselves on their durability, stood in a loose circle around a human cadet sitting on an exam table, clutching his ankle. The cadet, Miles, had his face twisted in agony, his breaths coming in sharp gasps. Professor Eltic, a tall insectoid being with 4 luminous eyes, clicked his mandibles. I fail to understand the human pain threshold. This is a minor sprain. Caleb raised an eyebrow. Minor? His ankle is swelling fast. Could be a ligament tear. Eltic let out a chittering sound, turning to the other students. Humans seem to exaggerate pain frequently. This is now the 3rd case. A scaled student named Vorash crossed his arms. The last one we treated was for a stubbed toe. The human acted as if he had suffered a fatal wound. Caleb sighed. Some people are more sensitive to pain than others. Doesn't mean we all exaggerate. The alien students exchanged glances, clearly unconvinced. Here, Caleb said, stepping forward. Let's get his boot off before the swelling gets worse. Eltic gestured for Caleb to proceed. As he removed Miles' boot and sock carefully, Miles let out a sharp hiss of pain. The ankle was already bruising. See, Caleb said, that's not just a sprain. Eltic studied the injury. It does appear more severe than anticipated. Curious? Caleb turned to the other students. Pain perception varies. Some humans feel pain more intensely than others. Some handle it better, but assuming we're all exaggerating isn't accurate. Varash's tail flicked. Then why do so many human injuries seem overblown? Caleb exhaled. Because some people react more dramatically, others downplay it. Eltic tilted his head. Downplay? Caleb nodded. Some humans ignore injuries even when they shouldn't. Eltic's mandibles twitched. I would like to observe this. Caleb shrugged. It's not exactly something you can schedule. Just as he spoke, a sharp alarm blared through the hall. Emergency call, Eltic announced. Medical response team, prepare. Caleb turned toward the entrance as the doors slid open, revealing 2 medics carrying a stretcher. A human lay on it, his uniform torn and stained with blood. Caleb's stomach tightened. He knew the guy. Connor, an engineering cadet. Eltic and the students rushed forward. The lead medic, a stocky reptilian named Dr. Shore, spoke quickly. He was working near an exhaust vent when a support beam collapsed. He got caught in the debris. Connor's face was pale, his breathing shallow. Caleb stepped closer. Connor? Connor opened his eyes slightly. Hey, Caleb, he mumbled. Not as bad as it looks. Caleb frowned. His leg was an ugly mess of torn fabric and deep gashes. Blood oozed sluggishly from one particularly bad wound near his thigh. Eltic's eyes widened. Why is he speaking as if he is unaffected? He is losing blood rapidly. Caleb looked at the medics. How bad? Dr. Shore's tail flicked. Fractured femur, multiple lacerations, possible internal bleeding. Caleb clenched his jaw. That was bad. Eltic turned to Caleb. You said some humans downplay pain. Is this what you meant? Caleb nodded grimly. Yeah. Some of us don't show it even when we should. Eltic studied Connor. Fascinating. Why would he do this? Caleb helped stabilize Connor as the medics prepped him for surgery. Lots of reasons. Some humans don't want to seem weak. Some don't even realize how bad it is until it's too late. Eltic clicked his mandibles again. This is concerning. Connor coughed weakly. I'm fine, he muttered. Caleb shook his head. No, you're not. Stop talking. Connor chuckled, but the sound was weak. Just a scratch. Eltic turned to his students. This is the opposite of exaggeration. This is dangerous. Caleb sighed. Yeah, and it happens more often than you think. Dr. Shore gestured toward the operating bay. We need to move him. Caleb watched as the medics wheeled Connor away. Eltic was still watching him, his 4 eyes blinking in sequence. You were correct, Caleb. Some humans exaggerate, some do not. But this willingness to ignore pain is deeply illogical. Caleb folded his arms. Maybe, but it's how some of us are. Eltic exhaled through his spiracles. I wish to understand this further. Caleb rubbed his temples. You might not like what you find. Eltic's mandibles twitched again. I am beginning to suspect that is true. 2 days later, the medical training hall was tense. A few alien students gathered around a holographic projection of a human nervous system, their expressions ranging from confusion to skepticism. Professor Eltic stood at the center, his mandibles clicking as he gestured toward the projected image. The human pain response, he announced, remains inconsistent. Some react intensely to minor injuries, while others exhibit alarming indifference to severe trauma. Vorash, his scaled arms crossed, studied the projection. Their nervous system is not significantly different from other species with high pain sensitivity. Why the extreme variance? Caleb, leaning against a nearby table, exhaled. It's complicated. Pain isn't just physical, it's psychological too. Some humans react based on instinct, others suppress it for 100 different reasons. Eltic's eyes gleamed. Connor's case demonstrated suppression to an irrational degree. His injuries warranted immediate distress, yet he dismissed them entirely. A student with translucent skin, Liren, tapped a claw against the table. Then why do others react to small pains with such intensity? If they can suppress pain, why not do so universally? Caleb shrugged. Because pain serves a purpose. It warns us when something's wrong. But some humans ignore it when they think staying composed is more important. Vorish flicked his tail. That is illogical. Caleb let out a dry chuckle. Yeah, well, humans aren't always logical. Eltic turned toward him. How do you, personally, respond to pain? Caleb hesitated. Depends. I've had moments where I've freaked out over something small. Other times I've brushed off injuries I probably shouldn't have. Eltic's mandibles twitched. You have done both extremes? Caleb nodded. Most humans have, to some degree. Liren narrowed her eyes. How does one determine when to react and when to suppress? Caleb rubbed the back of his neck. That's the thing. A lot of us don't think about it consciously. It's just habit, instinct, experience. A chime interrupted them, signaling an incoming medical case. Eltic turned toward the door as a trainee stumbled in, clutching his arm. He was human. The alien students immediately straightened, watching closely. The trainee's face was pale, his breaths uneven. Think I dislocated my shoulder, he muttered through gritted teeth. Eltic stepped forward. Describe your pain level. The trainee let out a slow exhale. Pretty bad, maybe a 8 out of 10? Varash's tail flicked. You seem calm for an 8 out of 10. The trainee let out a short laugh. Yeah, just trying to keep it together. Caleb stepped up. Let's get you seated. Eltic observed closely as Caleb carefully helped the trainee into a chair. Do you require sedation? The trainee shook his head. Nah, just pop it back in. Liren's eyes widened. You are requesting immediate correction without pain management? The trainee clenched his jaw. It'll hurt either way. Might as well get it over with. Eltic exchanged a glance with the other students. This is another example of suppression. Caleb sighed. Yeah, but this one makes sense. The faster we fix it, the less damage in the long run. Eltic gestured for Caleb to proceed. Caleb positioned himself, bracing the trainee's arm. On 3. The trainee nodded. Boom. Caleb pulled sharply, resetting the joint in one fluid movement. The trainee let out a sharp grunt, his face momentarily twisting in pain before he exhaled, his shoulders relaxing. Yeah, that sucked. Eltic's mandibles twitched again. You deceived him. You did not reach 3. Caleb shrugged. Better that way, less anticipation. Loren's translucent skin darkened in confusion. Humans not only suppress pain, but they manipulate each other's expectations of it? Caleb chuckled. Yeah, sometimes that helps. Eltic turned back to the trainee. Your pain level now? The trainee rolled his shoulder carefully. Dropped to a 5? Vorash shook his head. I am beginning to believe humans are deliberately unpredictable. Caleb grinned. We just handle things differently depending on the situation. Eltic's gaze lingered on the trainee before he addressed the class. It appears human pain response is not merely inconsistent, it is adaptive. Their reactions shift based on circumstance, necessity, and even social expectation. Liren crossed her arms. That is unsettling. Caleb smirked. Welcome to dealing with humans. Eltic exhaled. I believe I am beginning to grasp the complexity, though I suspect there is still much we do not understand. Caleb clapped him on the shoulder. You're getting there. Eltic's mandibles twitched again, but this time there was something almost amused in the gesture. 3 days later, Caleb stepped into the medical hall to find Eltic and his students gathered around a new case. A human cadet sat on the examination table, his face tight with discomfort as he gripped his forearm. Blood seeped between his fingers from a gash running along his wrist to his elbow. Eltic's mandibles clicked as he gestured for the students to observe. Another example of human injury response. Let us examine the behavior. Caleb moved closer. What happened? The cadet exhaled through his nose. Sliced it on a maintenance panel. Didn't think it was that deep until I saw the bleeding. Liren's translucent skin pulsed with shifting colors. You did not feel the severity at first? The cadet shook his head. Felt the sting, but I was in the middle of repairs. Noticed the blood a minute later. Eltic turned to Caleb. This is another case of suppression, is it not? Caleb crossed his arms. More like distraction. If his focus was elsewhere, his brain didn't process the full extent of the pain immediately. Vorash studied the wound. But now that he sees it, he acknowledges the pain? The cadet gave a wry chuckle. Yeah, it definitely hurts now. Eltic gestured for the medical kit. This provides further evidence that human pain response is situationally influenced. The physical damage did not change, yet his perception did. Liren tilted her head. Does this mean humans can override pain at will? Caleb shook his head. Not exactly. We can push it aside if we're focused on something more immediate, but once we're aware of it, it hits like normal. Eltic's eyes gleamed. Then why in Connor's case did he not acknowledge his injuries even when fully aware? Caleb exhaled. Because some people push through even when they shouldn't. Vorash's tail flicked. And some react as though minor injuries are catastrophic. The inconsistency remains baffling. Caleb gestured to the cadet. You good for stitches? The cadet gave a short nod. Yeah, just do it quick. Eltic observed closely as Caleb cleaned the wound and began suturing. The cadet barely flinched. Liren narrowed her eyes. You are experiencing pain, yet you remain still. The cadet let out a slow breath. Sensing makes it worse. Better to just let it happen. Eltic's mandibles twitched. So, in some cases, humans choose to endure pain calmly? Caleb nodded. Pain's unavoidable sometimes, some people just accept that. Vorash tapped his claws against the table. There appears to be no single rule governing human pain response. It varies by individual, circumstance, and even awareness of the injury. Eltic folded his arms. This makes treatment unpredictable. A human patient may either exaggerate or suppress their symptoms, making accurate assessment difficult. Caleb tied off the last suture. That's why human doctors rely on more than just verbal reports. We check vitals, body language, other indicators. Eltic exhaled through his spiracles. Medical care for humans requires far more interpretation than expected. Caleb wiped his hands clean. Yeah, you can't just take what we say at face value. You have to read between the lines. Liren's skin darkened in contemplation. This is inefficient. The cadet chuckled. Tell me about it. Eltic observed him for a long moment before turning to the class. It appears we must rethink how we assess human patients. Caleb leaned against the table. Welcome to the challenge of treating us. Eltic's mandibles twitched again. Indeed! 5 days had passed since the discussion about human pain responses had begun dominating the medical hall. By now, the alien students had stopped assuming they understood how any given human would react to injury. Instead, they had started observing with a mixture of fascination and caution, as if each new case might overturn whatever they had previously learned. The latest patient was a human cadet with an injury to his ribs. He had taken a bad fall during a training exercise and was now sitting on the examination table, his breathing slightly uneven. Caleb stood nearby, arms crossed, watching as Eltic and the students assessed the situation. Eltic's mandibles clicked as he ran a scanner over the cadet's torso. The display showed clear bruising and a probable fracture. The injury wasn't life-threatening, but it was painful and would take time to heal. Vorash studied the readings. His tail flicked as he addressed the cadet. "Your respiration is uneven. You are in discomfort." The cadet gave a short nod. "Yeah, hurts to take deep breaths." Liren's translucent skin shifted in color as she examined the scans. "This should cause considerable pain with movement, yet you show little outward reaction." The cadet exhaled carefully. "Not much I can do about it. Hurts either way." Eldic observed him for a moment before turning to Caleb. "This is another instance of a human suppressing pain." Caleb nodded. "Yeah. Broken ribs aren't something you can do much about besides rest and manage symptoms. No point in making a fuss." Liren tilted her head slightly. "But the pain is constant. Would vocalizing it not be a natural response?" The cadet shrugged, then winced at the motion. "I mean, sure, but complaining won't change anything." Eltic turned back to his students. "This is a marked contrast to previous cases. The injury is severe, yet the reaction remains subdued." Vorash's claws tapped against the table. "Does this indicate that humans only react strongly to pain they believe will pass quickly?" Caleb considered the question. "Not necessarily. Some people just handle chronic pain differently than sudden pain. If you know something's going to hurt for a while, you adjust to it." Eltic's mandibles twitched as he contemplated this. "So the duration of pain influences response as well?" The cadet let out a careful breath. "Kinda. If something's short and sharp, you react instantly, but if it's drawn out, you learn to deal with it." Liren's eyes narrowed. "This adaptability is unsettling. It makes human pain assessment unpredictable." Caleb nodded. "That's why it's important to ask the right questions. Some people downplay pain, even when they shouldn't." Eltic gestured toward the cadet. "And in your case, you have chosen to endure it with minimal reaction." The cadet gave a small, lopsided grin. "Not much of a choice, really." Vorash exhaled slowly. "It is deeply inefficient that human pain responses vary so greatly. It makes medical treatment unnecessarily complicated." Caleb chuckled. "Yeah, well, we don't do it on purpose." Eltic's mandibles clicked once more as he turned to his students. "It is clear that human pain tolerance is not determined by physiology alone. Psychological factors, experience, and situational awareness all play a role. This makes predictions unreliable." Liren's skin darkened slightly. "So, each human must be assessed individually, with no assumption of their reaction based on prior examples." Caleb nodded. "Exactly." Eltic glanced back at the cadet. "You will require rest and restricted movement for proper healing. Attempting to push through the pain would be inadvisable." The cadet sighed. "Got it." Eltic turned toward Caleb. "This exercise has revealed more complexity than anticipated." Caleb smirked. "Welcome to dealing with humans." Eltic exhaled, his mandibles twitching. "Indeed." 5 days after the rib injury case, things had shifted in the medical hall. The alien students no longer assumed they could predict how a human would react to pain. But that didn't mean they understood it yet. If anything, their confusion had only deepened. The latest case involved a human cadet named Julian, who walked into the hall with his hand wrapped in a makeshift bandage. He was holding his wrist close to his chest, but his expression remained neutral. Eltic and his students gathered around immediately. Eltic gestured toward the injury. "What happened?" Julian unwrapped the cloth, revealing a deep gash across his palm. "Slipped while handling an equipment panel. Caught myself, but the edge was sharp." Liren's translucent skin pulsed slightly. "That wound should be causing considerable discomfort." Julian flexed his fingers experimentally. "Yeah, it stings." Borish's tail flicked as he examined the wound. This is not a minor injury, yet you act as though it is of little concern. Julian shrugged. Nothing's broken, just needs cleaning and stitches. Eltic's mandibles clicked, his attention shifting to Caleb. This is another instance of minimal reaction to an injury that would typically warrant distress. Caleb nodded. He probably knows it looks worse than it feels. That's common when the wound is clean but deep. Liren narrowed her eyes. But previous cases demonstrated that some humans react intensely even to minor injuries. How do we determine who will downplay pain and who will amplify it? Julian let out a short breath. If you figure that out, let me know. Eltic observed him closely. Are you suppressing the pain, or is it genuinely tolerable? Julian considered the question. Hurts, but nothing unbearable. I've had worse. Vorash's claws tapped against the table. So, prior experience influences reaction? Caleb nodded. If someone's been hurt before, they have a reference point. If they've had worse injuries, they might not react strongly to a new one that doesn't compare. Eltic turned to Julian. What is an injury you considered severe? Julian's expression remained neutral, but he hesitated. Broke my arm when I was younger. That was bad. Liren's skin darkened slightly. And you reacted differently then? Julian let out a dry chuckle. Yeah, that one. I screamed. Eltic's mandibles twitched. So, a human's perception of pain is shaped by previous experiences. A lesser injury may seem insignificant if they have endured worse. Caleb folded his arms. That's part of it, yeah. It's not just about the pain itself, it's about what they compare it to. Voash exhaled slowly, which means even severe injuries may be dismissed if the individual believes they have endured worse. Julian glanced down at his hand. I guess that's true. Eltic gestured for medical supplies. Then this is another variable we must consider. A human's perception of pain is not solely determined by the injury, but by their past experiences with pain. Liren's gaze lingered on Julian's wound. This makes human medical treatment increasingly complex. Two individuals with identical injuries may display entirely different responses based on their history. Caleb gave a small nod. That's why human doctors ask about pain history. They don't just look at the injury, they ask how it feels compared to what the patient has dealt with before. Eltic worked carefully as he cleaned Julian's wound, applying antiseptic. Julian barely flinched. Liren watched closely. If this were your first injury, would you be reacting differently? Julian exhaled. Probably. If I hadn't been hurt before, this would seem worse. Vorash's tail flicked. So the threshold for response is not fixed. It shifts over time. Caleb leaned against the table. Exactly. Pain tolerance isn't something you're born with. It changes based on what you've been through. Eltic finished the last suture and stepped back. This is a critical factor we had not accounted for. A human's pain response is not merely inconsistent, it evolves. Julian flexed his fingers carefully. Yeah, that tracks. Liren's expression remained unreadable. This means we cannot assume that any human will react the same way to the same injury, even if we have treated them before. Caleb nodded. That's right. Even the same person might react differently to the same injury at different points in their life. Eltic exhaled through his spiracles. This is proving to be more complicated than anticipated. Caleb said, That's humanity for you. Eltic regarded him for a long moment before finally inclining his head. We understand now.